Himanshu?
Thank you, Sarita. I'll actually continue from where Sarita left off when she put across two of the slides highlighting that we're facing India as the country which faces a critical shortage is what is highlighted across in every single report. Not just that, it's not just a challenge of size or distribution or competencies, but it also is one of the difficulty that we commonly encountered till about a decade ago was a financial crunch in resources. Now, with the rise in the GDP, there's been an increased absolute commitment from part of the federal government towards health. That is one thing that changed. The second bit of change or the catalyzing factor that we had was the initiation of something called as the National Rural Health Mission, which provided us with institutional frameworks of sorts, strengthened primary healthcare, also brought in a new cadre of public health professionals who started working within the health system. At the primary level, we had a lot of new workers who were hired across in every single village of the country. But more importantly, at every single block, which probably equates the size of a county here, we had somebody who was appointed as a block public health manager. Now, what do these people actually deliver? They are the ones who would integrate all the efforts that the national programs are putting into the health systems and serve as a liaison between the government as well as the local health needs of the people. Now, they're expected to play certain roles and responsibilities, of which being a public health manager entails they should have some leadership skills. But is there something formal which has been developed across for them, or are they just expected to gain it on the job? The answer was the latter, that they were actually being groomed across the moment they were doing their actual work at their side of functioning. Now, this is where we could convince and talk to the government, saying that if you're getting these people in, we can do something substantial and probably lead to some improvements over time in the health system as a whole. So this is where the entire project actually fitted in quite nicely as well and gave us the necessary okay and the approvals from the institutions in order to go across for this. The second bit, which was interesting for us, is that although we all talk about leadership and a leadership training model, we recognize that it's not the knowledge that we are going to transmit across in a 3-day training program. Leadership is something that is exhibited at the site of work. And how do you actually translate your knowledge and what you're actually giving in your program into something which changes at the level of the field? Not just talking to the people who matter more in terms of the stakeholders, but we actually even went across and asked these individuals themselves as to what you expect. And the unanimous answer which emerged across, which exactly the colleague from South Africa highlighted, which the Krausers had pointed out to us yesterday, it's the intersection of the two Venn diagrams, which was even a felt need. What the people themselves said at the ground level is maybe something that we need across. The second bit is that there are efforts which were anyways undergoing as part of the national health system to develop task-specific leadership within the health sector. But what the felt need emerged out was we need some general leadership skills, something to do with actually talking, communicating well. These are the bits which probably are not part of any formal curriculum in India, but need to be stressed up a lot more. Of course, there is a lot of questions about as to how do you actually bring in the integrity part of it in a leadership model? How do you bring in commitment? These are values that people are born with, who develop them over time. But demonstrating this for us was an extremely big challenge, and we look forward to a positive result at the end. Interesting times ahead.